Good evening and welcome to tonight's MDPen Webinar, Corrective Microneedling, the Ultra Error of Collagen Induction. My name is Stephen Potter with MDPen, and we're thrilled to have you with us as we explore how corrective microneedling is defining what's possible for both practitioners and patients. This session is being recorded, and attendees will receive a link to review the recording. Now, before we begin, a few quick housekeeping notes. Today's session will run for approximately 1 hour, so please use the Zoom Q&A tab below to submit your questions at any time. We'll answer as many as possible during the session and towards the end of the doctor's presentation. You'll also see a few short polls pop up throughout the webinar, and we'd love your participation because they help us tailor the discussion to your experience level, and your participation qualifies you for our prize drawings. Very exciting. So here's our agenda. First, we'll meet our speaker. We'll hear what is corrective microneedling, and we'll have an Ask the Expert Q&A session. We'll also talk about why you are different and what that means, and we'll have some final polls, and we'll conclude with some special offers. Speaking of special offers, we will draw names for individual prizes for participating in each poll. And anyone who participates in all the polls and the post-webinar survey will be entered to win the grand prize. Now, we have a welcome poll, and as you can see, we have a bottle of wine here. So the winner for this particular poll will be eligible to win this bottle of wine. So please, we ask you to participate, get involved, share your experiences with us, and we would like to know, how long have you been microneedling? Has it been less than 1 year? Between 1 and 3 years? Between 3 and 5 years? Between 5 and 7 years? Between 7 and 9 years? Or more than 9 years? So we'd love to hear from you, and give us a little pulse on what you're thinking and feeling. All right, we'll give you folks another second here. Great, so let's take a look at the results. And look at that, across the board, we have a lot of different perspectives here. Looks like most folks are less than a year, so very new to this. And thank you for participating. Okay, so before we begin here, I would just like to talk a little bit about the MDPen brand. It's been a leader in microneedling innovation for over a decade, and tonight's presentation will showcase the next evolution, corrective microneedling, a biologically intelligent approach that goes beyond collagen induction to activate fibroblasts, keratinocytes, and even angiogenesis for full skin regeneration. We have heard corrective microneedling referred to as a game changer because it turns you from a technician into a clinician, directing regeneration, not just creating injury. That's exactly the shift we'll explore tonight. So I'm pleased to introduce tonight's speaker. I'm going to bring her onto the stage here. And a physician who has helped hundreds of patients realize amazing results with MDPen microneedling. Dr. Jamie Heskett will walk us through how the MDPen Ultra device and clinical protocols are changing both patient outcomes and practitioner success. Please help me welcome Dr. Jamie Heskett. Doctor, the floor is yours.
Thanks, Stephen. I'm super excited to be here. I am a huge fan of corrective microneedling, and I want to just give you a little bit on my perspective, so that you can see my perspective. I've been doing longevity and aging medicine for about 25 years now. I've been microneedling for 15 years, and the basis of my practice is really how to harness the body's natural ability to rejuvenate itself. And so for me, corrective microneedling fits right in there like the missing puzzle piece. And if I look at I have a lot of technology over the last 25 years, millions of dollars worth of equipment that range from body contouring to facial rejuvenation. Um, and I can honestly say that corrective microneedling and one other technology that I use are give me the most results, the best safety margins, and also the best revenue for my business, the most profit actually. Um, and so when you look at providing um, services and to satisfying the needs of your clientele who are coming into you looking for rejuvenation, whether it's face or body, I think from my perspective, the most important thing is for you to be able to satisfy what someone's needs are, to be able to keep that, have client retention, to know that what you're doing is safe, to be efficient, and also to have a thriving business, right? It's not one of those things, but it's all of those things. And corrective microneedling really, for me, in my experience, the last 15 years has been a top player in that. So I want to share with you um, what I think are the most potent aspects of this corrective microneedling with MDPen, because I think if you understand that, you can share that with your clientele. Your clientele will then feel confident in you. You will feel confident because using this technology, the corrective microneedling, will give you the confidence knowing that you're going to be able to produce results for your clientele. And this will be a really sustainable feature for your practice. So I think that's what my perspective is on this. So let's get right into like what is actually corrective microneedling. We've all seen it on social media, these young women who are swirling these pens on their faces. And I just want to really clarify that this is next level. This is taking your practice from being just something that someone can flippantly do to something you can do with thoughtfulness, with an understanding of physiology, with a safety margin, and with real results. So when you talk about corrective microneedling, you're talking about technique and you're talking about technology. So the technology is the MDPen, and the technique is how we administer the MDPen. And we're talking about um, the microchannels that are produced when you use the MDPen with the technique. There are aspects to this that are, I think, the pillars of corrective microneedling. One is how deep and how many microchannels can you get? Like when you talk about depth, you're talking about how accurate it is, your device delivering where that needle goes. The second aspect of it is what are you using to put in those microchannels? Um, the third aspect is what parts of the skin are you actually stimulating? We have ablative, we have sublative, um, we have peeling, we have dermabrasion. So these technologies that do rejuvenation act on certain aspects of the skin. So what aspects of the skin is microneedling attending to? And then again, what I think is probably one of the most important things is safety, efficiency, and delivering the results. Can you feel confident that every single time you're going to be able to be confident in what your client is going to experience after you do this technology for them. One, two, more. So let's talk about, I'm going to talk a little bit about the differences between traditional microneedling and corrective microneedling. So traditional microneedling, we sort of have all these options. We can go from as low level as a roller device that has maybe a variety of sizes of needles on it that you roll over your skin. You know, you can pick one up for $20 to $30. You throw some hyaluronic acid and you roll that over your skin. I hope that everybody in this conference understands and knows that that is not what we are, that is such low level, rips the skin. You have no control over the depth. it- this is, we're just going to push that one straight aside. And then, there's these pen devices. And I was just talking about a story. I had a client come in yesterday, actually, and we were going to do microneedling on her. And she says, I've been doing microneedling at home. And I just want to let you know that I go to 2.5 millimeters on my skin. And this is a young woman who has very nice skin. And I looked at her and I said, there is no way that you are doing 2.5 millimeters on your skin. She goes, no, no, no. I use the dial and the thing, and it says 2.5 millimeters. And she says, I would really like you to do 2.5 millimeters on me. And I said, I am 100% sure you're not doing 2.5 millimeters. Where did you get this pen from? She goes, well, I bought it off of Temu. It was $300. And I said, I guarantee you that device was not well calibrated. There's no way you're doing 2.5 millimeters. I did her scan. I did it at 1. I got beautiful bleeding. I got, beautiful density of microchannels. And she was really surprised that I was able to get that level of response from her skin with just 1.1 millimeters of depth. So the technology is out there in various forms, but it doesn't mean that it's all the same. And the most important thing is your level of control over the device. So when we talk about MDPen versus, if you even want to compare it to something that is on some sort of similar level, the difference really will be that the number of microchannels that you can actually generate with the device. So MDPen, with the technology and the technique, really allows you to get about 3 times as many microchannels per square inch than even any device that's even close to them. And when you are able to deliver 3 times as many microchannels, you can theoretically understand that you're going to be regenerating 3 times the amount of tissue. And when you're regenerating 3 times the amount of tissue with very little downtime, you are going to be providing really significantly more results with this corrective microneedling technology and technique put together. The next level of that, and I addressed it a little bit, is that the control of the device is exceptionally important. The 2.5 millimeters that my client said she was doing is on her face is not possible. And if you're unable to use the dial to confidently know if you're doing 0.5 millimeters or 1 millimeter or 1.5 or 1.25 or 0.25, you can overtreat, you can undertreat, you can do damage, and you're going to have inconsistent results. So if you are able to know that if you're doing 0.25, you're getting 0.25, and you're using the technique, which prevents you from overtreating and undertreating, then every time you do someone's procedure, they're going to walk out your door and you're going to feel super confident what their downtime is going to be, what their experience is going to be, and what their results are going to be. That's going to allow you to feel um, to sell the procedure more. It's going to allow you to um, stay within the range of safety, which means less people will come back to you, the next day and be disappointed, or say you said you promised me this, but this is what happened. Reducing all of that is, as a practitioner, it's 90% of the process. And if you're able to deliver those consistent results, then what's going to happen over time is that every single person that leaves is going to feel confident in you. And then they will share that confidence. And if you can drive your business with word of mouth because someone feels confident in you because you delivered what you said you were going to deliver and you did not send them home looking differently than they expected, it will skyrocket your business. And it's gratifying on all levels. It's gratifying as a practitioner because you've just made a difference in someone's life. And it's gratifying as a business owner because you are going to be able to seamlessly grow your business with just this one technology. Um, when I talk about when I talk about technique and technology being the MDPen, technique is the smart zone mapping. So I think you've probably seen a lot of social media um, videos where people are going like this, or they're doing round circular movements are very common. Um, Again, this leads to over treating, under treating, possibly damaging the skin. It's really unpredictable to do a circular movement anywhere on the face. And if you're chatting, you don't know if you've done it 4 times or 5 times or 3 times. And even if you say you're doing it 1, 2, 3 times, you're counting, it, it's it is a pattern that is difficult to reproduce every single time. So the smart zone mapping allows you to predictably treat every single square inch of the face in a way that you can reproduce every single time. Consistency is key to getting the density of the microneedling, the microchannels, and and um, and reducing your risk for adverse outcomes. Um, so I think we're going to go to, all right. Eventually, I'm going to show you what that technique looks like so that you'll understand. Is there any questions so far? Do you want to see if there's any questions in the chat?
Nothing yet, but we will get back to you.
Okay. So density, depth, and physiological response. So I covered this a little bit. Density meaning how deeply are the needles penetrating the skin, and the MDPen with the technique, like I said, is about 3 times the number of microchannels produced. The microchannels really go into the tissue, and each aspect of the tissue is regenerated. This is what really separates this particular technology and technique from any other facial rejuvenated technique. Maybe there's one other one, but in terms of like access to technologies, this is the most accessible technology that treats every single aspect of the skin. And for me, the most important one is angiogenesis. So when you look at the layers of the skin, you've got the keratinocytes, which are the uppermost layer. You've got the collagen, you've got elastin, you've got extracellular matrix. That's the stuffing in between all of the collagen and elastin. And then you've got the microvasculature. So if you understand that ablative techniques, peels, sublative techniques, lasers, radio frequencies, these all do a little bit of damage, and then the body will naturally repair itself. That's great if you're 25, when your microvasculature is still great. You poke your skin and you bleed. But as you get older, that microvasculature will recede, and you poke the skin and you really don't bleed. And to get that repair cycle going, you really need the blood flow. You need the microvasculature to deliver the stem cells, the rejuvenative enzymes, the oxygen, the nutrients, the messengers from the brain that tell the body to rejuvenate itself. So you can see when you're doing these ablative technologies versus something that's going to additionally rejuvenate the microvasculature, this is just on a completely different level. That is why this that corrective microneedling really can achieve that next level of rejuvenation that is easily sustainable over time. And the reason is because you've got that high channel density throughout the layer of the skin that also will penetrate into the microvasculature, causing the angiogenesis, along with collagen rejuvenation, um, elastin rejuvenation, keratinocyte rejuvenation, as well as the extracellular matrix. Depth control is super important because you don't want to go too deep. You don't want to go into the, underneath. You don't want to go completely through the skin. You don't want to hit any larger blood vessels because then you'll get you'll get bruising. So the fact that you can have in this very highly calibrated depth control allows you to go all the way up to the lash line on the lower lids. And this is an area that's very difficult to target in a lot of people. It's very sensitive tissue, and you can get incredible results if you're doing something like a CO2 laser or you're doing fractionated radio frequency. You're really just you're doing sort of a temporary retightening of the collagen elastin, and you're doing some micro damage, but the repair process is just really not as efficient because you're not targeting the vasculature. You're not targeting the microvasculature where you're going to get over time growth of new blood vessels that will supply the tissue with um, youthful blood flow. And that youthful blood flow is what makes skin look so young. You rejuvenate that, that's sort of the magic ticket. Um, so to be able to go from 0.1 to 2.5 also allows you to treat anyone who's in their 20s to someone who's in their 90s and really still get wonderful results without doing a lot of damage, without causing a lot of downtime. Um, even in I'll do someone who's like 70 or 80 years old who, the first time I'll microneedle them, they won't even barely be red because they have so little blood flow to the exterior of the skin. But by the time I do the third one, I'm getting bleeding. And I haven't changed the depth of my needles or anything. But that angiogenesis, that growth of those new blood vessels, have rejuvenated their skin to a younger skin, not just turned over the collagen elastin. This is particularly important for things like scar tissue, for stretch marks, um, which respond very poorly to these other sublative heat technique, laser technologies.
Okay, doctor, I'm just going to jump in here and comment. It's such an incredible explanation of how angiogenesis supports visible skin rejuvenation. It's amazing to hear that with corrective microneedling, higher microchannel density directly translates to more vascular renewal and faster collagen remodeling. And I know you just spoke of that. So, doctor, please continue.
This next slide, the angiogenic response is one of the most powerful elements of corrective microneedling. I can't say this enough, and I think it always surprises. I am always surprised, and it surprises my clients, this particular element. And the reason is I think that even though we are practitioners and we understand physiology and we understand this is an element that is often lost because it's not really in the lexicon of, we always talk about collagen elastin, because all of the products stimulate this. It's just that's the language, and there's not a lot that will actually do angiogenesis. And so it's I think that clients don't really understand the physiology. And when you explain this to them, like when I get someone in and they're like, I got wrinkles and I want my face to look younger. 100%, this is my first go-to corrective microneedling. even if they want filler or Botox, I always tell them, I say, listen, I said, if you can remodel your home a million times and eventually it will make no sense. Like you'll be like, this house makes no sense. There's no flow, it looks awkward. But if you start from the basics, clear everything out, and then add the elements in that are are more design elements, you will have a result that makes sense. And so corrective microneedling makes your skin look like it makes sense. And it is 100% because of the angiogenesis aspect of it. And so when the clients understand this, they understand then the difference between this corrective microneedling option and all the other options they're hearing about. And to be able to separate it like that, I think is not only what makes this so special, but also what allows you to, you know, not not push people, but to thoughtfully direct them into this as their primary um, treatment, and everything else is sort of on will work better after they've done this. So sometimes um, I do fractionated radio frequency after I've done 3 microneedling, but I will do a spot treatment. I'll do spot treatment under the eyes, or I'll do a spot treatment on the neck, because that fractionated radio frequency will now work better on this person because they have good blood flow. Because if I do some micro damage to their skin, they will be able to rejuvenate better because fundamentally their skin is more youthful and is more capable of rejuvenating. Just it's just physiology. And I think if you add that into your conversation with them about why this procedure, this choice makes the most sense for them, I've almost never had a client say that doesn't make any sense. I would like to choose something else. Um, So again, micro injury, that's what we're doing with the micro channels, is just those little teeny tiny micro injuries, new collagen, new elastin, new barrier, you know, when you have that increase in cellular turnover, you reduce the pigmentation. So when you're speaking to this, they're going to get tone, they're going to get texture, they're going to get clarity, they're going to get fine wrinkles, they're going to get laxity, and then at the end they're going to have better blood flow. So even if you have to explain it, it's like going to the gym. Doesn't your skin look so great after you go to the gym because it pushes all that blood to the to the surface of your skin and you have that glow? Well, that's the kind of glow that young people have, and that's the kind of glow you can achieve with the corrective microneedling. So oxygen, nutrients, people do understand what blood flow means. They just don't understand that over time, their blood flow gets reduced, and that's why they have aging. So if you can just impart that little bit of information to them, I really think that it's a rare person who says, nah, I think I'll choose something else.
Okay, doctor, before you move on, we have a question from the audience. Does angiogenesis provide better blood flow and nutrients in all age groups?
Absolutely. 100%. Like I said before, I could do a 30-year-old and not see good blood flow. I mean, genetics has a big play in this. We all know if you lined up 10 30-year-olds, everybody would have different types of skin, different levels of aging of their skin. But we all have the capacity to rejuvenate. And so anytime that you, again, do micro damage and then supply to that micro damage the biologics, whether it be PRP or PDR, um, exosomes. You can use hyaluronic acid, but that's not a biological stimulant. It doesn't regenerate the tissue. I mean, so if you can use PDRN or PRP or exosomes, things that actually do have that capacity to rejuvenate the tissue, to stimulate um, the fibroblasts and all the cells that actually need to be turned on in order to produce new blood vessels. And that's why I never understood well, anyway, I think it's important to understand that the bleeding is important. And when you get to the bleeding point, you know you've made a physiological change. You can share that physiological change with your patient. They will then relate that physiological change with their improved status of their skin. And then you can say, listen, like now we just have normal aging. So if we keep stimulating this a couple of times a year, you're going to retain that level of blood flow to your skin, which means you will retain these results. Um, there's other aspects of aging that change how the face looks, but the skin is going to look wonderful over a period of 20, 30 years. Um, I mean, I have better skin now than I did in my, I graduated medical school 30 years ago. Um, I have better skin now than I had 30 years ago. And if anybody wants to see a picture of me, I just found one because I have my 30-year reunion. I will send it to them. And I will send them a picture of me now. And they will see that the quality of my skin, I have less wrinkles than I did when I graduated from medical school. Now, granted, I was under a lot of stress at that time. But the key is keeping the system stimulated. It's just like muscles. It's just like really anything. If you keep the system stimulated, and sometimes we have to trick the body into, thinking that it's important to rejuvenate the skin tissue because it doesn't really care. It's not like contributing to the decline of your ability to live in this world, but we can we can do things, which is what corrective microneedling is, to remind the skin to rejuvenate itself. So I wouldn't hesitate to do this treatment on anyone of any age if they're interested in having better skin, and everyone will be thrilled. Let's see. Oh, this is key: pigmentation and melanocyte regulation. Um, I I have found I do a lot of IPL. I do a lot of fractionated radio frequency. Um, it's tough to do those things and feel really confident with the higher Fitzpatrick skin types. Obviously, microneedling you can do on anyone, so that's a real win there. Um, the risk of hyperpigmentation is not there because if you use the technique and the technology, so you're not over treating because you're using the MDPen and you're using the technique, you're not going to overtreat, so you're not going to create any kind of like excessive inflammation that might create an post-inflammatory reaction. In 15 years, I've never had anyone have anything but reduction in pigmentation of the skin when it's an undesirable pigmentation. Um, and so, for that reason alone, you just open up your options for a whole host of people who, may be at high hyperpigmentation risk. Um, to be doing other ablative and sublative technologies. And I think, people want to have the best results with the least amount of downtime, the least amount of discomfort, and the least amount of risk. And I think if you were to line everything up on a sheet and put the little check boxes in, this checks all those boxes. Everything else doesn't. But on top of that, you get a real physiological result in adjusting the age of the physiology that's happening in the skin versus just doing sort of damage and repair.
Doctor, before you move on, just going
Mhm.
to get to another question. At what depth do you go to stimulate the cells properly?
That's a great question. So the technique, and we're just about going into that, the smart zone mapping, the technique is really very well prescribed, but in any individual client, you have to assess the situation. And for me, I always act on the conservative side because you are going to do 3 treatments on this person. So if you mess up the first one, you're not going to get them back for the other 2. But if you go conservative on the first one, which I think generally is like, what's the median? And then does this person have very thin skin or is this person have very thick skin? And I say if someone has very thick skin, you could try out going a little bit deeper, but if you're experienced. If someone has thin skin, you will go a little bit less, but most people will stay right in that middle area. So you're talking about 0.5 millimeters on the forehead, 0.25 around the eyes, 1.0 to 1.25, sometimes 1.5 on the fleshier parts of the face, zero point 0.5, 0.25 on the nose, depending on how fleshy the nose is and what part of the nose you're doing. Around the lips, my choice there is how much wrinkling do they have on the lips. If they have thin skin, I'll go less, but I like to be aggressive around the lips because um, that's a sore spot for a lot of people. And it can generally handle going like 1.0. I probably wouldn't do 1.5. It's just not necessary. On the neck, I usually do anywhere from zero point 0.5 to 1.0. And I would tell you, I don't really vary from that very much. I get the results. I don't get any kind of extra downtime. And if you follow the protocol, you're going to get the results and not have any problems. And so when you look at the smart zone mapping, you can treat people both preventatively and then correctively. So I would say most of my patients are corrective. And really, you're just sort of doing more areas. You're kind of eliminating around the eyes. Um, and the preventative, you will probably be doing a little bit. You can use some of the different cartridges, but you might do something that's in between those two as well. And so I think it's just always smart to say, here's the protocol, and then I'm going to assess the person individually. And you really can't go wrong with that. And you can't go wrong with being conservative the first time because they will get the results. Don't feel the pressure to like, oh my gosh, this person has these horrible lip lines. I'm just going to go after them because if you give them some bruising around the lips or some excess downtime, again, they might not come back for you, but you have two more times to up the ante if they've done if they've done okay the first time. You can be like, oh, I'm going to go up 0.25 on the lips this time because last time, easy breezy, everything was perfect. Um, so I think that that's my answer for that. There is no exact for everyone, but there is a protocol, and you really should start with the protocol, assess which way to go based on the person's skin. The truth is, if you go deeper, if you use the right numbing cream, it's not like they're going to feel more discomfort. And if even if you go less, especially with this particular technology, you're going to get enough penetration for them to see a really nice result in 3 to 4 weeks. All right, so I think we're going to do a little video here of the technique. And so this is what allows you to get that 3 times of the microchannels into the skin. You This will also, it completely allows you to be chit-chatting and not over treating and not missing something. Those are the 3 aspects of why the technique is so important. I will say that I actually do one extra pass than this. So I do 2 diagonals. I do one diagonal and then I do 90 degrees to the same diagonal. That's just how I've done it for 15 years. I don't know if that was an original technique that was taught to me. And so this is great. I think it's okay probably to add that little extra one in. On the nose, I just think, I know that there's some people who will, there's a technique where you can punch, so you can punch the needles into the skin while they're actually moving as well. And I really don't use that except for in the case of deep acne scars and deep pigmentation. Um, I know some people will use it on the nose. I don't love to use it on the nose. Um, I like to, I think it's okay to sort of, go with the curvature of the nasoflares. And, some people's skin is more bone, the skin is very thin over the top, it's very bony. And so I think you have to really just look at the person's nose. If someone's got a lot of tissue, you might want to be a little bit deeper. And you probably will change the depth on the nose. The key for me is to really pull the skin tight. If you pull the skin really tight, right between the brows. Just below that is a place where people really have a lot of problems, especially as they get older, especially with the extracellular matrix. And if you pull that really towards the top of the forehead really tight, you can get it to come up over the brows, and it's a little bit easier to get the coverage there. Um, so that's the preventative. I'm going to go to the corrective. So the corrective is exactly the same, except for that you're doing around the eyes. And it's just super important to remember that you really want to pull the tissue tight. So pull that eyebrow up as far as you can. I use like a nice gauze because that'll hold the skin. And to really make sure that you're doing the technique over bone on that upper eyelid. And the lower eyelid, same. I pull it a little bit down. Just you really want it to be tight because you don't want it to be dragging on the skin. What's really nice about the new version of the MDPen is that it has these little channels in the cartridge, which allow you to, put the biologic in the area that you're treating and not worry so much about losing contact with the biologic. It sort of passes right under there. So to do the under eyes is fairly easy. But you can see how if you do this technique, you are literally hitting every single area. If you do like a circular movement or just kind of like random movements, you will not get an even treatment. And so and also you won't get enough depth of penetration, depth of the microchannels. You won't get the density of microchannels that you really are possible with this tool.
Doctor, I'm just going to jump in one more time here. We had another question come in.
Mhm.
Michelle, can microneedling be done even if the person has recently been in the sun?
Well, no. I usually have people wait at least 2 weeks, and that's if they were in the sun, but they weren't directly in the sun. Do you know what I mean? So they're not, they haven't had a lot of sun exposure to the area that I'm treating. Um, just because the skin is going to be a little bit more fragile. Um, and you don't know if they had a little burn, and it's just better to wait. There's no rush. And if you're we had a few of these questions last time where there were these sort of outliers of people who kind of you didn't know if you should treat them or not. And I think that with this particular technology you can treat a lot of people. Um, but if there's one person who raises your red flag, it's just not worth it. um, you'll have another client will replace them. I think that's just a little bit of my I've been doing this a long time wisdom. If there's anything that makes you feel nervous about doing someone, or that they have some sort of condition that you're not 100% sure about, you know, you can redirect them to something that's a little bit less invasive, um, and probably avoid some problems. That's just until you get a little bit more experience, or until you track down their doctor who's dealing with their other problem. So the being in the sun, that's that's like that's almost it's just let them get out of the sun for a while, a month. Waiting an extra 2 weeks is not going to kill them. Just say, let's just wait a month. I think that's probably what I would say to most people. Corrective tracing with the ultra. Is this the video? Yeah. So this is just demonstrating with the new channeled cartridge, doing the technique of going laterally and then vertically at a 90-degree angle, and then doing the angles. Now, I like this video because there was a little red line that it showed there. That is not like a scrape. That's the person's bleeding, and then the little micro channels creating that. So um, the great speed. I would probably pull the skin a little bit tighter, and I would use a gauze. I think it's just your glove gets a little slippy, and so to use like a sterile piece of gauze is really helpful. So that's the doing little punches um, in the nose. I think that's okay. I think sometimes that can be a little uncomfortable. It's a little bit more aggressive. I think you can probably do a smoother movement around the nose and still get great results, especially if you pull the skin tight and keep the depth of the needle in a reasonable place. Yeah. I always do neck. I never just treat someone's face. Um, I've just seen too many people who have their face taken care of and their neck looks different than their face and it's contiguous. I think you can stop at the collarbones because that's a sort of a marker. I do the chest on a lot of people, but I would charge a price that you know, make sense for the amount of time that you have to do extra for doing someone's neck. But I include neck in all my treatments. I think the clients are always surprised that I include the neck. But then I explain to them, I say, listen, I said, it's contiguous. And if your neck looks different than your face, and then I always call up a few celebrities where I'm like, well, have you seen, so and so's neck and their face? Like their face looks great, but you can really see the neck. And so if you're delivering it, it takes you so little time to add the neck in. And it is such an added value that it will sit in your client's mind in such a way that even if it takes you extra and you charge the same amount, it will come back to you in spades.
Doctor, I'm just going to jump in again. After watching that video, can you talk a little bit about some of the non-traditional body parts that you've worked on?
So I have done almost almost every possible body part with the corrective microneedling. You can do the earlobes. So if someone's got a little there's if their earlobe is a little hangy, you can tighten that up and make that a little bit smaller. If they've got a scar there from maybe I've had a lot of clients who've had um, the earring has pulled through and then they've had to have a stitch put in there and have a little scar. I would do the front and the back of the ear. It's super easy to do. I love doing arms. I don't do the full arm in general because that's a lot of tissue. But i- if you've treated women, you know that there's sort of a stripe that goes down, um, sort of midline to the armpit, down just about below the elbow, maybe 6 inches or so, and that skin gets crepey, and it's really hard to treat. And if you add that on to if they're doing someone's face and neck, you add that on, charge a little bit extra, you know, um, maybe draw an extra tube of PRP. It works really well, and I don't even numb it because it doesn't really need it to be numbed. So it's pretty quick to do. I've done the, the upper part of the belly. Um, the thing is, in choosing to do a larger area, the important part is to assess what's around the area. So if you want to do a small area that doesn't have a lot of gravity on it, right? Because you can only do so much. So, for example, if you're looking at someone's abdomen and they're like, "Oh gosh, I've got loose skin everywhere," you're probably not going to want to do the whole abdomen. But if above their belly button, say there's like a little area like this, it's not a lot of gravity pulling on it. And if it's a little crepey, say they've had a couple babies or something like that, you could definitely do that. Same pattern. I probably would do a little bit deeper, 2.0, maybe 2.5, and that will tighten up their skin. It's a really nice option. I do stretch marks. I do post surgical scars. I love doing the key with the stretch marks and the scarring is that it's healed just enough so that but there's no microvascular aspects of that scar. That's why it looks the way it looks, but it's healed enough for the body to say we don't need to heal anymore. So once you restart that healing process by creating new blood flow in that area, y- you really can get about 50% improvement in the stretch mark. And 50% improvement in stretch marks for people is they're thrilled. like really thrilled because you'll get, it'll become less deep, it'll narrow, and the top part will repigment and it'll smooth. And even if it's more pigmented, the pigmentation will sort of even out. So it's very worthwhile to do stretch marks with the corrective microneedling. I've done the tops of the knees, mostly in, if it's this sort of size of an area, I wouldn't do like the full thigh. Um, I always, if I'm assessing a client, I always look at the hairline and I say, is this woman have a little thinning in the hairline? Not so much in the back because we can do corrective microneedling in all over the entire scalp for hair growth, but as sort of like a little add-on to doing the face and dipping your toe in the water. Interestingly enough, if you do maybe just add in, say, oh, I noticed that you've got like a little bit of thinning here, and I'm going to do that part for you. They're going to notice that they're going to get some hair regrowth probably within that first month. And if you convert that person into a hair client, so you've done 3 microneedlings for their face, and then you've done maybe 2 or 3 for that little patch. And then you say, listen, if you want to keep going with the hair, I do a reduced price for the hair because they come in way more times for it. You've now captured that client in between her 3 face microneedlings and her maintenance microneedling. So she's going to come in a few times in that 6 months period of time to get her hair done. You've just extended that one client who already believes in you to do more, right? So um, I love that because who doesn't want more hair and better skin if it's kind of going south? Trying to think if there's any. I do hands. I do hands. But I would choose small areas that have a prescribed section of loose avascular crepey skin. That's what I would choose because that the benefit it will make a difference. You won't be too time consumed. You can do an add-on price, which makes it worth your while, and you're not kind of taking on something that you're not going to give them good enough results for your time and the money you're going to make and the money they're going to pay. Did I forget anything? I don't think I forgot anything. Um, I mean, here's the truth. You've got about 15 minutes when you're done. Keep those channels open and deliver something in there. And so what I love about the company is that they have a very prescribed line of biologics that you can use in that 15-minute window. I do 2 masks because I like to try and like I do a sterile gauze mask and then I do a peptide collagen mask. And I use all of the biologics that MDPen, but it just depends on what I'm trying to achieve with that particular client. So if someone's got a lot of pigmentation, I'll use a particular topical. If someone is got more laxity or fine wrinkling or super dry skin, I'll use something that's more towards lifting and tightening. Um, or I'll use hydration, one of the three. The key is that that these products, it spans all the options that you probably need, but also like it's safe to use with microneedling. Not every topical product that's out there, just because you can deliver it through microchannels into the skin, is made for this. And so I, I would just be cautious about what you actually put on the skin immediately afterwards. Um, because again, you want to keep the therapeutic benefit and keep the risk low. Um, and so you got your bases are covered with the options that are provided for you. I would just say that additionally, I do a sterile gauze mask with sterile water, and then if I have any PRP left over, I'll saturate the mask with that. Or, sometimes I'll do a little PDRN underneath the eyes, a little extra afterwards because it's a small amount and it will really, really boost it. But take advantage of that 15 minutes. I mean, going anywhere. There we go. So here's the options, hydration, stimulating angiogenesis. The copper hyaluronic acid mist is wonderful for that. Obviously, hyaluronic acid is great for hydration. This is great for you and anyone who's got that really dry, plumpless skin. Um, the cellular renewal, the tighten and lift, obviously to stimulate collagen and elastin. I love the human derived growth factor gel. I will often send them home with a little jar of it. And if I have any extra PRP, I'll put the PRP in it, mix it up, and tell them to use that within the first 24 to 48 hours. Um, so your all of your needs are supported here with safe products that won't cause a problem. And then, obviously using any kind of biologics is next level. So PRP, if you want to do it, if you don't have the setup for that now, it's actually not that big of a deal. Use PDRN or exosomes. You're in most of your clients, that's going to work great, and you don't have to draw blood and waste have that time. You can combine them all, which is next level. I combine them because I still love doing PRP, and I think that if you can do it, it definitely sets you apart because a lot of non-medical practitioners are not using that. And I always like to, I think people understand that what's coming from their body is good enough.
Doctor, I'm just going to jump in again here.
Yeah.
We have a lot of questions. One
Okay.
has been, has there been any benefits or use in using NAD with microneedling, or is PRP best?
I don't use NAD. I I think it's kind of like a single it's like a single bullet, right? So I think that for me, the to keep it simple and to keep my product line manageable, and to keep my costs down, truth be told. Um, I really have had great success with PRP and PDRN. I do PRF as well, not with the microneedling, but um, yeah, I haven't really gone down that road, but I think it's sort of like a single factor, right? So using a single factor alone, I don't know that it's going to I don't think it's gonna encompass the scope of what you want to achieve. Um, I think that's just sort of my baseline
Hmm.
opinion on that one.
Okay, I just have another one I'm going to reach. What device speed is recommended for each zone?
So faster is less. It really creates less discomfort and obviously more microchannels. So I really mostly do. I do it on the high speed for mostly everything. I feel like it glides a little bit better than the slower speeds. I might do slower speed if I'm really trying to slowly work an area that maybe is a little bit more sensitive. Um, but I think it's pretty efficient to be at the higher speeds. That's my that's what I've practiced. I've never had a problem doing the higher speeds. But I use a lot of like if I'm the skin is saturated for me when I'm doing it. Um, and so I don't have any problem with drag or anything like that. Any other questions?
Nope, you can move
Nope.
on.
Okay. So just a review of what corrective microneedling is used for. Fine lines, wrinkles, skin laxity, acne scars. It works great. Stretch marks works wonderful. Pigmentation, melasma. Um, you know, if you're talking to people, talking to your clients about it, I just it's so easy to tell them what are the qualities of youthful skin. You can even ask them and they'll say, well, they have a glow. Well, you're going to get a glow. You know why they have the glow? Because they've got good blood flow, good oxygen, nutrients to the skin. That's youthful skin. Collagen, elastin, that's what keeps your skin tight. That's like, you know, that's the structure. And then what's giving life to that structure? That's the extracellular matrix. That's like the stuffing in the pillow. So if you can kind of come up with your very visual, communicative, I hate to use the word spiel, but how you're going to explain why this is better than everything else for them, I think that's what resonates with people. And that's what makes you feel confident that they're understanding what they're going to get, and they feel confident that you're going to deliver, because now they understand why they're doing this. And if you have to it doesn't have to kill the other things that you do. If you've got IPL, or you've got fractionated radio frequency or anything like that, this is what you do first, right? So think of how this is the foundation of repair to get all the systems going, epigenetics, turning on those genes. And then you can hit it with something that's going to like do a little micro damage, and then you're going to get the repair because that skin is ready to be repaired. Without this, the skin is not ready to be repaired unless you're young, unless you have youthful skin. So, not even if you're young, if you have youthful skin. So I think if they understand that, then it's going to be easy for them to make the choice. And it is absolutely the truth. So you are actually educating them so that they understand to make the choice in an educated way. Again, 20s and 30s, you can do the preventative. I've got I've got young women in their 20s who want to work on their under eyes too. They want to go a little bit deeper, but they probably have pretty good blood flow. So going superficially will allow them to and and have less microchannels is probably just fine for them, and they'll have a little bit less downtime. Again, um, to not ablate the skin, to not do so much damage that you change the quality of the skin, even if it's tighter, to be able to rejuvenate the skin from the inside out is, um, you know, gives you an optimal result. The fact that it's safe across the board when you can dial in with accuracy the depth and the amount of penetration and the number of microchannels that you can predictably get with the technique and the technology. So little downtime. I mean, everybody thinks like this is a lot of downtime, but within 2 days, I've got clients who are like, I'm good to go. Um, you don't have to worry about wound healing because pretty much the wound is healed by the time they walk out of the office. And so just on the level of safety, efficiency, revenue margin, results, low risk, high physiological um, effect, it just hits all the marks. And again, it's like the foundation of anything else you're going to do is going to work better. And when people understand that you're that thoughtful about how you're going to get them natural, long lasting, youthful results, they that really you're not just selling them a machine that you paid a lot of money for and you give everybody. They really take to heart that this is a thoughtful procedure, and really probably the best procedure for anyone who wants facial rejuvenation, and an amazing technology for your office, because the technology itself is not um, you're not paying $150,000 for your machine, right? You're not having consumables that cost you an arm and a leg. This is really a low investment, high reward on all levels. I think we talked about all this. Mm, so post care, the most important thing is hydration. They might have a little bit of peeling. I usually do an exfoliative facial a week to 2 days before. That really reduces any kind of peeling that happens. barrier repair. So to be using some of the barrier repair products is key. Some sort of soothing balm, because it can get a little bit itchy. Obviously, they need to use UV protection. I use a zinc-based mineral sunscreen, so that in and of itself is anti-inflammatory. And then, this is your opportunity for maintenance protocols, right? So they're going to be gone for you, for a month before they come back, or they're going to be gone for 6 months before they come back. You know, you want to give them medical grade cosmeceuticals that are going to keep that cycle of repair and rejuvenation going. And if you say, listen, this is literally like what I just did to your skin, you're going to be doing this at home. You're just going to keep doing the little workout, keep doing your little bicep, um, your crunches or whatever. You're going to do your maintenance while you're there, so that when we get you the next time, everything is still stimulated. So it's a real opportunity to make sure that your client is fully captured for the whole year. And if you do, like, they will get the best results. Again, the corrective microneedling will just set you apart from anybody else who's doing anything but corrective microneedling, right? Because you can just talk to the fact that you're turning on all the systems that give you youthful skin: angiogenesis, collagen elastin, extracellular matrix, keratinocytes. You're going to get tone, texture, glow, um, tightening, less wrinkles, less pores, all of it. It's like full circle. And when you're using a technology and a technique that is of the highest quality, anybody else who's doing a dermal roller or doing some pen that they got off of Timu with, a little jar of hyaluronic acid, like, this just allows you to level up without the risk. And with, um, with a real true physiological result.
Doctor, I'm going to jump in one more time here.
Yep.
One of the most exciting takeaways from this training is, this has been a recurring word, reproducible results, and how the results have become so reproducible. As our presenter said in the last session, when your results become reproducible, your reputation grows. Corrective microneedling standardizes success, and that's the real business case behind this innovation. So please, doctor, go on.
Yeah, I'm just going to reiterate that. When every client who leaves who's done this, you feel confident, they feel confident in you. You've been able to predictably give them both the results, the predictable downtime, um, and the education and understanding of why this is the best thing for them. Those clients will go and each one will tell 10. Not only will they be your client for life, or for as long as they care about what their skin looks like, but they're going to bring a ton of clients to you. And I will say, this is my most sustainable procedure that I do for client retention. Not the M sculpt, not the lasers, not the body contouring, not the vellus shape. None of those are client retention like microneedling. I could drop off the face of the earth and the clients would still be trying to contact me about when their next microneedling is. I could send out not one email and they will come back in 6 months and say, I think it's time for my microneedling. It is the most sustainable client retention procedure that I've seen in 25 years of my practice. Uh, I love this. It's not just poking the skin. It's high tech poking the skin, but it really is. It seems so simple, and it is. And your clients will say, well, it seem so simple, but sometimes the most simplest things are the most physiologically sound. Like, just don't complicate things. This does what you need it to do, and everything else can marry with it. Um, so anyway, it's not just poking the skin, but it kind of is. There we go.
Okay, great. I'm going to jump in. I know we did quite a few questions already. Thank you very much, everyone, for submitting your questions. This concludes our presentation, and we're going to just move on to a few more items here. So thank you, Doctor. I'm here to introduce Kevin, who's a partner. Kevin Simons is a partner with MDPen, and he will talk a little bit and give you more information. So Kevin, the floor is yours.
Thank you so much. And Dr. Hesketh, thank you so very much in regards to your presentation. I really enjoyed it. It's great. You know, for just about 13 years, we've been training in the corrective microneedling technique and with the signature tracing motion. And it really is the key factor that sets our practitioners apart. And that's the big difference. I think when you look out what is going to make a difference for you in the marketplace, and what is it that can differentiate me from everyone else in the market? Well, it's your technique, it's you, it's the system, the number of micro channels that you get, and the consistency. We draw the analogy of like sipping wine. This is realistically like sipping wine and not chugging. We're not in high school or college and chugging beer. We're actually doing this in moderation, and moderation is like your dose control. You're getting the right depth, you're getting uniform passes, you're getting controlled endpoint. You're not overindulging, just like Dr. Hesketh said, with doing circles. You're being very consistent and intentional. The flavor and aroma are like your tissue cues. That's actually the notes, the erythema, the minor pinpoint bleeding. Reading these slowly, really judging that. In the pairing, how do you pair the topicals? Just as you pair wine with food, corrective microneedling pairs with regenerative actives, hyaluronic acid, copper mist, tighten and lift, cellular null, peptides, and human-derived growth factors. And in between that wine, you're getting a sip of water. This is your barrier support, your hydration, your barrier protection. And then it's all about the conversation. Several times Dr. Hesketh made comment about if you're having a conversation with your patient while you're doing the procedure. Well, being able to have that feedback, engaging with the patient about sensation, endpoint, and aftercare compliance, which is the big part. So let's talk about the device. It's FDA cleared. The initial clearance for the system is on acne scars. It's 510K. It's an ultra-fast microchanneling device. So it puts in up to 324,000 microchannels per minute. The average device in the market puts in approximately 108,000 microchannels a minute. It has an adjustable depth control from 0.1 to 2.5 millimeters. Ergonomic design, very simple and easy to hold in your hand so that you can get in those fine areas, whether you're doing an earlobe, around the lips, around the nose. There's any of these areas, along with treating some of those larger ones. It has a cordless operation, so you can run it without a cord, and you can run it with a cord. If you decide that you want to run it without a cord, you have 4 hours of use on a 45-minute charge. So, but in electric mode, you can run it. It has 7 different settings to be able to do it. The other part of this is we have a lifetime warranty on the system to ensure that peace of mind for you when you make the investment in the system. So there are 2 needles. As Dr. Hesketh went over, we talked a lot about corrective microneedling tonight. You have the correct needle head, which has 36 needles in the cartridge. They go from 0.1 to 2.5 millimeters. This is ideal for texturial improvement and depth correction. And then prevent. I often use this analogy. It's kind of like that lady who says, well, I don't want to look like my mom. So she's doing the preventative treatment. She's being a little bit more aggressive in doing what we kind of call collagen bulking. It's designed for, fine line smoothing and collagen remodeling. So for those of you who are ready to upgrade, which are MDPen customers, who are quite a bit of you all on the line, thank you so much for joining. Type in upgrade in the chat and we'll have someone to contact you from our team. And then we have the webinar promotions. And so here are the promotions. So the MDPen Ultra Biologic Kit, or just your basic system, the MDPen Ultra, comes with a box of PDRN. It also comes with 1 box of exosomes. It comes with 20 Ultra needle cartridges. It also comes with the 1 ounce bottle of copper mist, tighten and lift serum, cellular renewal, hyaluronic acid, and 10 packs of numbing cream. Then you get the live online training program from the MDPen educators. You also have your digital clinical documents that come with it, the digital Ultra user manual, and the marketing kit. Within that marketing kit, we actually have a 1-year social media posting for you. So that's content that is created for you based upon microneedling so that you don't have to recreate everything all over again. So the promotional price of this is $3,995. It is a $1,317.20 saving. And how to access this promo? You can actually contact us by simply scanning this QR code. It'll take you direct to the actual link. You can type in this link, which is MDPen Webinar offers. And then also you can contact our representative, Ashley Wilson, for MDPen support. Her phone number is 678-772-5111. So current customers, check your email. We just sent you an email notification also for additional special promotions for you. Now, let's go to our final poll questions. We have 1 round of questions before we close, and everyone who participates is entered to win a back bar bottle of UltraGlide serums, the copper HA mist, the hyaluronic acid, the human-derived growth factor gel. So let's roll out the poll questions.
Excellent. Thank you, Kevin. Here we go, folks. We'd love to hear from you. Corrective microneedling is defined by the density difference up to how many microchannels are created in the skin every minute. What do you think? Again, this is a chance to win one of our grand prizes. There are a few, so please take a minute to participate. Okay, let's see the numbers here. All right, 87%. Looks like most people are thinking up to 324,000 microchannels. All right, and we have one more here. Again, another chance to win our grand prize. Which of the following cells are primarily responsible for collagen and elastin production during corrective microneedling? Which one is it? We talked about it, and we'd love to hear from you. Okay, let's see what the numbers say here. And a good 74% fibroblasts. Very good. Thank you, everyone, for participating in that. And we will move on here. Now, let's talk a little bit about some of the fun things. The grand prize will go to one lucky participant who's participated in all the polls and completes our short post-webinar survey before midnight tonight. You'll see the survey link on the screen as the event ends. But as you can see, there's very nice options for you to win the bottle of wine, the backpack, as well as some of the skin care products. So thank you all. We want to thank you for joining us this evening. We hope this session helped you see why corrective microneedling isn't just a treatment. It's a clinical system designed for real correction, consistent results, and long-term patient trust. If you'd like to learn more, you can scan the code here to schedule a live demo of the MDPen Ultra and connect with our team for integration resources. So on behalf of MDPen and our presenter, thank you for spending time with us tonight. We'll see you next time as we continue redefining skin correction through science. Take care, folks.